Today let's talk about antihypertensive therapy in patients with arterial hypertension and concomitant diseases in real clinical practice, according to the National Registry of Arterial Hypertension, 2019 to 2022. Arterial hypertension remains the leading risk factor associated with cardiovascular diseases, cerebrovascular disease, and chronic kidney disease. About 70% of patients with arterial hypertension who are on monotherapy cannot achieve blood pressure targets, and therefore all guidelines for the management of arterial hypertension have recently recommended prescribing combination therapy. In real clinical practice, there remains significant uncertainty in the effectiveness and rationality of therapy, despite the wide availability of antihypertensive drugs and the presence of recommendations for a stepwise approach to prescribing combinations of specific groups of antihypertensive drugs in different clinical situations. Analyze the real ongoing antihypertensive therapy, including the prescribing combination therapy, international non-proprietary names of drugs, and their dosages in real clinical practice, compliance of therapy with clinical recommendations, changing trends in the prescribing combination therapy. Coming to materials and methods, an analysis was carried out of the data from the Register of Arterial Hypertension, the compliance of treatment in different clinical groups of patients, and the achievement of blood pressure and low-density lipoprotein cholesterol targets in the sample of 2019 to 2022. The prescription of antihypertensive drugs and achievement of targets values were assessed in accordance with current clinical guidelines for the management of arterial hypertension and hypercholesterolemia. Data from 2010 and 2020 were analyzed to assess the dynamics of prescription of monotherapy and prescribing combination therapy. Coming to results, the greatest increase in the number of antihypertensive drugs was observed in patients with hypertension in combination with coronary heart disease, heart failure, and atrial fibrillation. In a small group of patients with hypertension without other cardiovascular diseases, the recommended combinations of antihypertensive drugs were not prescribed. Preference was given to angiotensin-converting enzyme inhibitors, angiotensin receptor blockers, and beta-adreno blocker. Prescribing combination therapy mainly differed from the recommended combinations by the wider use of drugs from the beta-adreno blocker group. The prescribing combination therapy of recommended drugs was highest in patients with hypertension and coronary artery disease, more than 90%, hypertension and heart failure in 56.2%, hypertension and atrial fibrillation 33.3%, hypertension and chronic kidney disease 19.6%. Achievement of blood pressure and low-density lipoprotein cholesterol targets was insufficient in all analyzed groups. Among the international, non-proprietary names of drugs, the most frequently prescribed are the following: metoprolol, bisoprolol, lisinopril, perindopril, losartan, spironolactone, amlodipine, toracimide, indapamide, hypochlorothiazide, moxonidine. The prescribed daily dosages were closer to the initial recommended ones. By 2020, the prescription of prescribing combination therapy with beta-adreno blocker and a more uniform prescription of various combinations will come to the fore, while prescribing combination therapy in 2010 is characterized by the presence of one or two leaders' combinations. In conclusion, the described features of prescribing antihypertensive drugs partially reproduce clinical recommendations for the management of arterial hypertension. Differences in therapy provided in real clinical practice may be associated with an attempt to intensify the treatment of hypertension in patients with other concomitant cardiovascular diseases. At the same time, analysis of combinations and dosages of prescribed drugs suggests the presence of wide opportunities for further escalation of therapy. The presented data can provide insight into current patterns of antihypertensive therapy prescription in patients in real clinical practice and lay the foundation for optimizing therapy in different categories hypertensive patients.